Okay, good morning to all of you. Please. Okay, so we have completed gastrointestinal system in the last class. After going through your charts, still yet are to be tuned, and many of you are tuned already. So I can understand, but I can observe few are copying from me one chart, because the starting line, second line, third line, fourth line remains the same mistake. One mistake with the respiratory system was pleural edema. There is no terminology called pleural edema. It is called what edema? Collection of water inside the lungs, not within the pleural space. Pulmonary edema. So one candidate wrote pleural edema. About 10 to 12 candidates wrote pleural edema. Because pleural edema, the word was not told by me in the class. So unless I have informed about the word, you will not be aware of the word. So somebody has coined the word here, and that word has travelled for around 12 candidates. Okay, so I want to know who is the coining person. Okay, we will go to today's class. The rest of the classes, what we have is our excretory system concerned with the kidneys. Then you have the nervous system. Then you have the endocrine system. Today, what system we shall take? Excretory system. Okay. So today's topic of interest will be excretory system. So what do we excrete from our body? Only water? Water, salts, yes, oxygen. So the term excretory system does not mean exactly to the kidneys alone. Your lungs is an excretory system, your skin is an excretory system, and your kidneys are also an excretory system. So generally we tend to excrete what we don't use, like bogi patiyila நம்ம பழைய பொருட்களை கழிறோம் இல்லையா, அதுபோல oxygen is converted into carbon dioxide through gaseous diffusion. Lungs excrete carbon dioxide. The sweats, actually what is sweat? Is it excreting the extra water, or how do you excellent, please give a who is Shanmugapriya? Right. So it maintains temperature of the body. Like you take a 2 liter water bottle or something from your fridge, half liter or 1 liter, it starts sweating. So it wants to connect the temperature. So you have a process called perspiration. It is not respiration, it is perspiration. So it wants to, so sometimes you can see your mothers putting the milk packets in the water buckets. Yes, something hot coffee or mugla Penile vittu kalakkuvaanga, temperature regulate panna. So whenever your body temperature goes high and it changes, it needs to sweat out. So that is why sometimes when you are obese, you sweat even in spite of a fan. Have you experienced that? You see obese people always having a kerchief and doing, always they keep perspirating because of increase in the basal metabolic rate. Basal metabolic rate. What is basal metabolic rate? It is the process of anabolism and catabolism, in the process of metabolism, to run the basic functions of the body. That is why it is called basic metabolic rate. Basic functions. What are the basic functions of the body? Other than what you require for your wish, like respiration, breathing, eyesight, lungs, spleen function. So it needs a basal metabolic rate. And who controls the basal metabolic rate? thyroid. So we will discuss about this in the thyroid class. Now we have come to an idea that the excretion process is not related only what urination. Micturition alone is not an excretion process. So excretion is a broad terminology. So you excrete carbon dioxide, you excrete water and salts. Today our topic of interest will be excretion related pertaining to the kidneys. So generally with any system we initially start with some basic anatomy and physiology. So you understand this is the right kidney. It has an outer cortex and a inner medulla. And here you have the renal pelvis. Renal artery, renal vein, ureter, again one ureter, and this is urethra. Female urethra is generally short, 4 centimeters in long. Male urethra is little longer, around 15 centimeters in length. Female urethra is a single straight pipe, where male urethra is a 2 times perpendicularly bended pipe. So there is some importance for this to understand. And this area is called trigone of bladder. And this part, that is the part where the urethra and bladder meets, this is called vesico-ureteric junction. So what are all the functions of kidney? So this is anatomy of kidney. So what are all the functions of kidney? So only when you know physiology, you will know the pathology. One, it acts as a buffer system. What is buffer? Maintaining neutral pH. Please give him a hand. Neutral pH. What is neutral pH? 7.35 to 7.45. நம்ம மாவு தோசை மாவு சில சமயம் புளிச்சிரும். அம்மா என்ன பண்ணுவாங்க? கொஞ்சம் ரவை கலக்குவாங்க, அரிசி மாவு கலக்குவாங்க, கொஞ்சம் கோதுமை மாவு கலக்குவாங்க. அதே ப்ராசஸ் தான். ரத்தத்தை புளிக்கிற தன்மைக்கு பேர் தான் pH. அமிலம், காரம். அமிலம்னா acidity, காரம்னா alkali. So 3.5 க்கு கீழே போனா அது பேரு acidity. அமிலத்தன்மை அதிகமாகும் தன்மை. 4.5 க்கு மேல போனா அது பேரு காரம், alkalinity. So what are all the conditions that you have acidity and alkalinity? What is it exactly? Overproduction of HCl. Okay. Then later. Okay. Then you need to understand the pH of the body is maintained by two organs. The pH of the body is maintained by two organs. So respiratory, and then you call it metabolic. So, as she told, it is not exactly hydrochloric acid. Whenever the carbon dioxide is not excreted properly, whenever the carbon dioxide is not excreted properly, carbon dioxide increases in the system. It can happen when there is a failure in respiration. When failure in respiration can happen physiologically in obese people and people with OSA. What is OSA? Obstructive sleep apnea. OSA means obstructive sleep apnea. You can see some obese people sitting in the bank waiting for their turn, having tokens in their hand, or sometimes even in the home watching serials during the daytime with the remotes in their home. They fall asleep as seeing the television, or when they are alive or awake, the remote falls down. As soon as within few seconds as they board a bus, they sleep even before they buy the ticket from the conductor. அப்ப நம்ம என்ன பார்த்து என்ன சொல்றோம்? நல்லா படுத்து வச்சவரு நல்லா கொரட்ட விட்டு தூங்குறாரு. A noisy sleep is not a sound sleep. A noisy sleep is not a sound sleep. When air passes through a narrow passage, it causes sound, whistle. சென்னையில இந்த புயல்லாம் வந்த நேரம், உங்க ஊர்ல இந்த கஜா புயல்லாம் வந்த நேரம், புயல்ல சத்தம் கேட்குது. ஏன் புயல்ல சத்தம் கேட்குது? காற்று மெல்லிய பாதை வழியாக போகும் பொழுது சத்தம் உருவாகும். The concept of whistle. When you want to whistle, you want to obstruct the pathway. The air is blowing, and so why the airway is obstructed in OSA? Because of majority because of obesity. Majority because of obesity, the airway is obstructed. Thereby, carbon dioxide is it causes retention within the system. COT, that is carbon dioxide, is a narcotic. It causes sedation. It causes sedation, or it puts the respiratory system down. So when carbon dioxide is increased in the body, the kidney tries to buffer it by excreting through the kidneys, or when by metabolism, through metabolism, like you exercise, you work out more, they go for a marathon. That is why certain people with untrained marathon runners end up with kidney injury. Have you read in few articles in the newspaper? They fall sick because the kidney திடீர்னு ஒரு நாள் விட்டு துணியை போய் துவைக்க சொன்னா என்ன ஆவாங்க? அந்த வேலைக்காரமா விட்டு விட்டு நின்றுடுவாங்க. திடீர்னு 10 வீட்டு பாத்திரத்தை போட்டாக்கா 10 பாத்திரம் தேய்க்கிறவங்க கூட போயிடுவாங்க. So marathon is a sudden overload of metabolism where the kidney fails tremendously, and thereby it is not able to maintain the metabolism. So the kidney and the lungs try to maintain the pH of the body. Here kidney maintains the pH of the body by excreting through the urine. Here the pH maintains through the lungs by rapid exhalation. That is why when you are tired or fatigued, you breathe fast, tachypnea. So tachypnea comes in order to compensate to excrete the excess production of carbon dioxide. So kidney works as a first. It is not the main function of kidney is not to excrete urine. Urination is a process, but the ultimate aim of kidney is to maintain the pH value through working as a buffer system. Second, it helps to maintain the metabolism of glucose glycogen. Glucose glycogen balance, I have already mentioned. Glycogenolysis, glycogenesis, gluconeogenesis, 3 process. Conversion of glucose to glycogen as a storage product is called glycogenesis. Conversion of glycogen to glucose in times of need of glucose is called glycogenolysis. Gluconeogenesis is production of glucose from a non-glucose parent, that is from fatty acids and amino acids. Conversion of fatty acids and amino acids to glucose is called gluconeogenesis. It happens during the period of fasting and starvation, gluconeogenesis. So this entire metabolism is also maintained at our kidney. So sometimes the kidney mimics the function of a liver, because liver is also a detoxifying organ, kidney is also a detoxifying organ. Liver also maintains metabolism, kidney also maintains metabolism, but the only function liver doesn't do is not the buffering action. So liver and kidney mimics a similar function almost. 3. It helps to maintain the metabolism of minerals. Here the cortex and medulla, the cortex maintains the function of mineralocorticoids, and thereby it helps to maintain the bone mineral metabolism of the body, to maintain the calcium function of the body. So the kidneys work excellent work to maintain the calcium deposition in the body. 4. It produces erythropoietin. It produces, what is erythropoietin? Higher altitude. Okay, she has got the point right. She has studied in that way, that is why she is remembering that way. It is a hormone required to produce RBC. In higher altitude, you need more RBC. So she has studied the line in that context. That is why her mind has taken from the library the particular line and throwing it out. But the point is correct. The hormone helps in the, please give a clap for her. The hormone helps in the production of RBCs. So erythropoietin is secreted whenever climbing high altitude, whenever you are running more, when you are jogging more, in pregnancy, in lactation. So what is erythropoietin? Erythropoietin is not hemoglobin. It is இது வந்து தூண்டி விடுறது. So தவறு செய்யறது ஒண்ணு, தூண்டி விடுறது ஒண்ணு, நல்லது செய்யறது ஒண்ணு, தூண்டி விடுறது ஒண்ணு. ஒரு நல்ல ஆசிரியர் என்ன செய்யலாம், மாணவர்களை தூண்டி விடலாம், நல்லா படிக்கிறதுக்கு தூண்டி விடலாம். அந்த தூண்டி விடுதல் தான் இந்த erythropoietin. Erythropoietin is not hemoglobin. Erythropoietin doesn't directly function as hemoglobin. It induces the bone marrow to produce RBCs from pluripotent stem cells. Pluripotent stem cells are stem cells which can convert into any cell. It can convert into retina cell, rods, cones, nephrons, neurons. It can convert into any cell depending upon the requirement. சில சமயம் அதே மாவுல நம்ம இட்லி போடுறோம், தோசை போடுறோம், ரவா தோசை போடுறோம், பொடி இட்லி போடுறோம். ஸோ ஒரு மாவு வச்சு நிறைய விஷயங்கள் அம்மா பண்றாங்க. அந்த மாதிரி இந்த ஒரு ஸ்டெம் செல்ல வச்சு RBCs, WBCs, rods, cones. அப்போ இந்த erythropoietin will help. And 4, it also helps in maintaining certain hormones, especially steroid hormones related with the testis and ovary and with the calcium mineral metabolism. So what will happen if the functions of kidneys fail? You will get problems in all this. So the body will find it difficult to maintain the pH of the body. The body will find difficulty in maintaining the glucose metabolism. The body will fail to maintain the mineral metabolism. The body will have anemia. To put it in another way, so what will happen? The body will go for either acidosis or alkalosis. And thereby ending into encephalopathy. These words you would have read in newspapers. Multi-organ dysfunctions and metabolic encephalopathy. What is encephalopathy? Encephalopathy is a condition where the metabolism of the body is deranged and thereby the brain is not able to execute its normal basic function like maintaining conscious level orientation. What is conscious level? Arousability. இப்போ எல்லாம் நீங்க கான்ஷியஸா இருக்கீங்க. When you become unconscious, when you sleep temporarily, or when you are having any head injury, you become unconscious. Whereas because of the failure of the internal environment, வீட்டுக்குள்ள சில பேர் பெரியவங்க சண்டை போட்டாங்கன்னா குழந்தைங்களும் irritated ஆயிடும். போயிட்டு எங்கயாவது போய் மாங்கு நிடிச்சுக்கும், இருக்கிற துணிமணிகள் எல்லாம் இழுத்து போட்டுரும், ஒரு நிறைய டிஃபிகல்ட்டான சிச்சுவேஷன்ஸ் வரும். ஸோ அந்த மாதிரி internal environment, it is called milieu interior. Internal environment is called milieu interior. When the internal environment is failing, the brain also fails terribly, thereby its conscious level and orientation fails. That is why in ICU patients வந்து ரொம்ப irritable இருப்பாங்க, ரொம்ப irritable இருப்பாங்க, கையை பிடிச்சு இழுத்துருவாங்க, ட்ரிப்ஸ் எல்லாம் போட்டு இழுத்துருவாங்க. That is called ICU psychosis. ICU psychosis. The problem is not in the ICU alone. First, being alone in a bed, whenever already you are in a trouble and you are already being you are kept lonely, so you feel some loneliness and it develops into psychosis. But the basic problem for this ICU psychosis is a encephalopathy due to any metabolic problem. Some infection somewhere in the toe, especially this is very common. Even the chief minister's case, it's a diabetic foot, it causes infection, it causes septic encephalopathy. When the internal environment, now not because of the buffer system, because of the bacteremia, because of the septicemia, the internal environment is not good, thereby ending into encephalopathy. So encephalopathy is nothing but the brain is not able to deliver its normal basic function because of the failure in the internal environment. So the importance of pH now you will understand. So metabolism, glucose glycogen metabolism, the patient either being a diabetic or the patient either being already diabetic can fail, can cause a condition called DKD, diabetic kidney disease. For to understand this, you need to know two more terminologies. AKI, CKD. AKI is acute kidney injury. Chronic kidney disease. The names are self-explanatory, but you need to know the conditions. When can you get your kidneys acutely injured? Especially in when your kidneys can get acutely injured. Okay, medicine. Very common cause, common things are common. Alcohol, no. Huh? No, next. Injury. What injury? External injury. Not common. சரி, ஒரு ஹோட்டல்ல போய் சாப்பிடுறீங்க, இல்ல கல்யாணத்துல போய் சாப்பிடுறீங்க, சாப்பாடு சரியில்லைன்னா அடுத்து என்ன ஆகுது? Yes. Diarrhea is a common cause of acute kidney injury, especially in children. Small children, 5 years, 7 years, 10 years, when the diarrhea is not treated adequately with dehydration. How many of you have dogs at home? Okay. Are you aware of parvovirus? Yes. Rapid dysentery. The dog will die within 1 or 2 days. Parvovirus causes dysentery and it is blood stained. The body goes for dehydration. The metabolism collapses. The buffer system collapses. Heart goes for a tachycardia. The dog dies within 1 or 2 days itself. So similarly, small children, especially small children or adults, when they have diarrhea, when the water loss is not compensated. So water loss is compensated by what? By what feeling you have? Dryness of mouth, thereby causing thirst. But when the patient is in an encephalopathy, when they are dehydrated, என்ன ஆயிடும்? கண்ணெல்லாம் உள்ள சொருகிடும், நாக்கெல்லாம் வறண்டு போயிடும், they become unconscious and they are not able to quench their thirst adequately. So dehydration part ஒரு பக்கம் நடந்துட்டு இருக்கும், thirst mechanism even though it is working, it is not being compensated. Or even if they give, they try to vomit sometimes. Whenever they have diarrhea, you also have another problem called vomiting. Vomiting and diarrhea generally comes together with abdomen pain. Vomiting, abdomen pain, diarrhea. Normal leave letter la kuda nariya time adu eludhuvom illaya, vomiting, diarrhea. One day leave kana leave letter reason. So diarrhea, if not treated properly, it can cause kidney injury. Second is all what you have mentioned, like consumption of some poisons, like organophosphorus poison, mercury, சில பேர் இந்த oleander seeds, அரளி விதை, இந்த மாதிரி விஷயங்கள்லாம் சாப்பிடும்போது டாக்ஸிக் சப்ஸ்டன்சஸ் சாப்பிடும்போது kidney can go for injury. And as you said, somebody told about infection. Infection, when there is, these are rare causes. When there is an infection, the body is not able to excrete adequately. ஆமா லைன்ல இருக்கீங்களா?
ஆபரேட் பண்ணும்போது அந்த ஹாஸ்பிடல்ல இருந்து
அப்படியா? எக்ஸ்கியூஸ் மீ ஒன் மினிட். So acute kidney injury happens in, as we have discussed, in other conditions like the infections, injury, as you have mentioned. Acute kidney injury can happen through a blunt injury with the road traffic accident. So you have to understand about acute kidney injury. Then we will understand about chronic kidney disease. Commonest cause of chronic kidney disease is diabetes, hypertension. Diabetes and hypertension. Both are two different mechanisms. Diabetes condition, you pass hyperosmolar liquid through a filter. Hyperosmolar liquid, which means the blood can be in three forms, either like a water, like a milk, like a honey. Is it not? But the three liquids viscosity differs. Water is less viscous, honey is more viscous, milk is moderately viscous. Blood is supposed to be like milk. Blood is supposed to be like the viscosity of a full cream milk, like a full cream milk. When there is anemia, the blood becomes like water. In anemia, reduction in RBCs, the blood looks like water. Romba thanniya irukum. When the patient is in a hyperglycemic state, HbA1c more than 7, random blood sugar more than 300, 400, 500, 600, the blood becomes more viscous. The blood becomes more viscous. The valuvalupu thanma, pisu thanma adhigamaayirum. So when a hyperosmolar liquid, I consider here liquid as blood, hyperosmolarity is more thick, more viscous, in a condition called diabetes. Adha kondu poi kidney ingra filter la pass panningana enna agum? Filter அடைச்சிடும் இல்லையா? சில சமயம் பாத்ரூம்ல நம்ம வந்து முடி, இந்த ஷாம்பு கவர் அதெல்லாம் போயிட்டு சிக்கிடுச்சுன்னா என்ன ஆகும்? தண்ணி போகாது. அப்புறம் நம்ம என்ன பண்ணுவாங்க, கையில எடுத்துட்டு அடைப்பிட்டு போனா கடகடன்னு போயிடும். Constantly hyperosmolar liquid flowing through the kidney can cause glomerular injury. For that, you need to understand the functions of the function unit of a kidney is called nephron. So this is the afferent arteriole, glomerulus, Bowman's membrane, proximal convoluted tubule, distal convoluted tubule, Henle's loop or loop of Henle, collecting duct, collecting tubule. So afferent arteriole is the end point of renal artery. Efferent arteriole, so blood comes here, pushes fast. வேகமா சில சமயம் ஃபில்டர் நம்ம பண்ணுவோம் இல்லையா, ரொம்ப இது இருந்ததா நம்ம என்ன பண்ணுவோம், ஃபில்டரை ரெண்டு தட்டு தட்டுவோம். மாவுலாம் இல்லை, கடைசியாக மாவு இறங்கலன்னா நம்ம என்ன பண்ணுவோம், வேகமா அதை குலுக்குவோம். ஸோ அந்த மாதிரி the blood comes here, flows fast and it again exits back. In that process it comes to the proximal convoluted tubule, the loop of Henle, does all its filtration process, losing the sodium, potassium, collecting it back, excreting as urea and creatinine, and then then whatever is required is collected back in the interstitium. All these nephrons are placed in the kidneys. இங்க இருந்து ஆரம்பிக்கும் அந்த நெஃப்ரான் எல்லாம். நம்ம இப்ப பார்க்கிறது லாஸ்டா கலெக்டிங் டக்ட் எங்க வந்து ஓபன் ஆகும்? renal pelvis. All the collecting duct opens at the renal pelvis. This duct and excretes only as urine containing urea and excrete. The excretory product of urine is as urea and creatinine. Normal value of urea is 20 to 40 milligram percentage or milligram DL, milligram per deciliter. Normal value of creatinine is 0.6 to 1.2 milligram per deciliter. Okay. So when a hyperosmolar liquid, more thick liquid is passed through a filter, now filter கிழிஞ்சு போய்டும். ஃபர்ஸ்ட் அடைக்கும், அப்புறம் நாள் என்னாகும், நாள் போக போக என்னாகும், ஃபில்டர்ல இருக்கிற அந்த இலைகள் எல்லாம் விட்டு போகும். அதுக்கப்புறம் டீ குடிக்கும்போது டீல டீ தூள் கிடக்கும். டீல என்ன வரும்? டீ தூள் கிடக்கும். அந்த மாதிரி இந்த கிட்னி கான்ஸ்டன்ட்டா இன்ஜூர் ஆகி டயபெட்டிக் பேஷண்ட்ஸ்ல என்ன ஆகும்? You will have renal glycosuria and renal proteinuria. Renal glycosuria and renal, you can call it albuminuria. Proteinuria, okay. To be more precise, excretion of albumin. By nature, these two has to be preserved. The function of kidney என்ன? கிட்னில இருக்கிற யூரியா கிரியேட்டினை மட்டும் வெளியே தள்ளிட்டு புரோட்டீனையும் சர்க்கரையும் உள்ள வச்சுக்கணும். But when the glucose load is more, the kidney is not able to filter it properly. The hyperosmolar liquid is flowing through the Bowman's membrane. It is not able to filter. அந்த pressure தாங்க முடியாம, stress தாங்க முடியாம என்ன ஆயிடுது? எல்லா ஃபில்டரும் கிளிய ஆரம்பிச்சிடுது. The urine all starts to contain glucose and albumin. Thereby the excretion of glucose through urine is the primary cause for genital itching in diabetes. சுகர் அதிகமானா பேஷண்ட் என்ன கம்ப்ளைண்ட் பண்ணுவாங்க? உயிர்நிலையில புண்ணு வந்துருச்சு. For male it is called balanitis or balanoposthitis, phimosis. இது வழியா சக்கரை சிந்திட்டே இருந்தா என்ன ஆகும்? அத சுத்தி புண்ணு வந்துரும். The retractability of the prepuce, male genital organ, this is called glans, this is called shaft, the outer covering is called prepuce. Constantly excreting sugars via this area becomes very thick. Like பாதுஷால மேல இருக்கிற அந்த சக்கரை காஞ்சு போச்சுனா எப்படி இருக்கும்? நர ஆயிடும். ஸ்கூல்ல சில சமயம் நம்ம தப்பு பண்ணும்போது இப்போலாம் உங்களுக்கு இருக்குமான்னு தெரியல, கீழே மணல் உப்பெல்லாம் போட்டு நீல் டவுன் பண்ண சொல்லுவாங்க. எங்க பீரியட்லலாம் அது இருந்தது, உங்க பீரியட்ல இருந்திருக்காதுன்னு நினைக்கிறேன். இருந்ததா உங்களுக்கும் பரவாயில்ல. So it is a crystal. Sugar and salt is a crystal. Thereby it rubs and tears the skin. Thereby causes ஆரம்பத்துல இந்த மொத்த இடம் ஃபுல்லாவே புண்ணாயிடும். That is called balanoposthitis. நாள் போக போக இந்த முன்தோல், the foreskin causes difficult to come back. Generally foreskin is like your eyelid. It constantly opens and closes to keep it clean. But when it is not opening and closing, what will happen in the eye? It can cause dacrocystitis, trihardiolum internum, hardiolum externum, so or a corneal ulcer, or whenever the shutter is not opening and closing properly, the particular area will get affected by various mechanisms. So similarly, when the prepuce is not opening and closing properly, it causes balanitis, balanoposthitis, phimosis, thereby causing infection. And it is the commonest cause of genital itching in diabetes patients, not alone in males. In females, it causes itching of the labium majorum and labium minorum. Labium majorum and labium minorum, it causes genital itching, and then it acts as a super infection with fungal depositions, ending at white discharge in elderly. White discharge is otherwise called leukorrhea. Leuko means white, urea means discharge. So this is the mechanism of chronic kidney disease in diabetic patients. How chronic kidney disease can happen in hypertension? Here we saw hyperosmolar liquid. Now in the hypertension, it is pushing the liquid more fast than the usual. வேகமா தண்ணி விடும்போது என்ன ஆகும்? அந்த இடத்துல நான் ஆல்ரெடி உங்களுக்கு சொல்லியிருக்கேன், வாட்டர் ஃபால்ஸ் ரீஃப் கீழே சொட்டாயிடும், அந்த இடத்துல பள்ளமாயிடும். அந்த மாதிரி ரத்தம் வேகமாக பாயும் பொழுது அந்த அஃபரண்ட் ஆர்டீரியோ எஃபரண்ட் ஆர்டீரியோல வேகமா பாயும் பொழுது இங்கேயும் பவுமன்ஸ் மெம்பரேன் கிழியும். Bowman's membrane will get injured and thereby causing glycosuria and albuminuria and thereby causing the overall function of kidney to come down. Overall excretory function of kidney to come down and thereby ending the patient as chronic kidney disease, which is generally seen as elevated urea and creatinine in the blood, and the treatment available right now for the patient in the end stage kidney disease is hemodialysis. Hemodialysis is a process, the artificial kidney, the blood is taken out, purified, again being, but it is a temporary process. Sometimes it can function even up to 10 years, no problem, it can function depending upon the disease of the patient. Because kidney is not alone the organ present in the body. The diabetes would have already affected the heart, diabetic ischemic heart disease, dilated cardiomyopathy, all this would have already come in the patient. So kidney நம்ம எவ்வளவுதான் பாதுகாத்து சுத்தமா வச்சிட்டாலும் heart சரியில்லைனா the body will fail. That is why these patients land up in this process are those patients whose food metabolism is not good. That is why initially I have given a chart, lifestyle disease is more important. இங்க kidney பாதிக்கிறதுக்கு என்ன காரணம்? அதிகமான உணவு போகும் பொழுது அதை மெட்டபாலிசம் பண்ண முடியாம எக்ஸ்கிரீட் பண்ண தத்தளிச்சு அதை வெளியே, அதனால தான் மருந்துங்கிற அதிகாரம் ஃபுல்லாவே உணவை பத்தி மட்டும்தான் போட்டிருக்கு. அதுல சித்தா மெடிசன் கூட போடல. சுக்கு சாப்பிடுங்க, ஆடு தொடல, சித்த ரத்த அது இதெல்லாம் போடல, பேரஸ்டமால், ஓவிரான் அதை பத்தியும் போடல, யுனானி மெடிசன் பத்தி போடல, ஹோமியோபதியோட பில்ஸ் பத்தி போடல. உணவை மட்டும் சீரமைக்க சொல்றாங்க. பசிக்கும் போது நல்ல உணவை தேர்ந்தெடுத்து சாப்பிடணும். ஏன்னா அங்க இருக்கிற ப்ராப்ளம் இங்க கிட்னில இன்ஜுரி வரைக்கும் ஆகும். So acute kidney injury, chronic kidney disease, you are having an idea. Then what happens? The infection in this place frequently in male or female can generally ascend up. வருமா வராதா? வரலாம். When the infection is at the excretory point, and already you know diabetes is a immunocompromised state. I would have mentioned in the class already. Diabetes, tuberculosis, HIV, this all obesity is a immunocompromised state. The infection can ascend up, and thereby the patient will start excreting frank pus in the urine. Already we saw empyema. Empyema is collection of pus in the lungs. Here it is called pyelonephritis. So py vandale pus, nephritis is kidney injury. So generally in elders, what happens, especially in the obese elders, obese fat females, not 40s, fat females, the genital area is jammed because of the circumference of the thigh, and thereby they have already stress incontinence, urge incontinence, and they are already diabetic, their HbA1c is high, their sugars are high, they are already having some genital itching. The process of genital itching is because of excretion of glucose. எப்படி முட்டிக்கால்ல உப்பு போட்டு நம்ம நின்றாக்கா முட்டில எல்லாம் வலிச்சு ரத்தம் வந்துரும். சில சமயம் 10 நிமிஷத்துக்கு மேல முட்டிக்கால் போட்டா ரத்தமே வந்துரும். So அப்ப என்ன ஆகும்? Patient will have infection. In order to compensate the infection, the patient will start itching. Second, again an injury, and thereby it causes pyelonephritis. This pyelonephritis is again a cause of, it can cause acute kidney injury. Somebody spoke about infection. So what infection? Infection like pyelonephritis. Initially, the pyelonephritis will start as UTI, urinary tract infection. Urinary tract infection, the patient will experience burning micturition. The patient will experience burning micturition. So dysuria, burning micturition is called dysuria. Sometimes ending into excretion of blood in the urine called hematuria, and thereby causing all this infection and excreting pus in urea is pyuria. Like hematemesis, hematochezia, hemoptysis. Coughing of blood is called vomiting blood, hematemesis. Frank blood in the motion, hematochezia. Black colored motion is melena. I am not informed. Have I informed? No, please make a note. Passing black stools is called melena. M-A-L-E-N-A, melena. Okay. So hematuria, pyuria, dysuria is burning micturition or difficult micturition, and sometimes the function of kidney will be lost so dangerously you start excreting very little urine, especially when you don't drink water. When your thirst mechanism is not good, whenever you are sitting in an air conditioner and you don't drink. So that is why air conditioners are not good for health. Your pH mechanism will change. உங்களுடைய ஸ்வெட்டிங் மெக்கானிசம் உடம்பு கன்ஃபியூஸ் ஆயிடும். திடீர்னு போய் டோரை திறந்து வெயில்ல நிப்பீங்க. அப்ப கொஞ்ச நேரம் சுடுற மாதிரி இருக்கும். உடம்பெல்லாம் குத்தும். சில நேரம் அந்த தோல்லாம் குத்தும். மாறி மாறி இருப்பாங்க. So air conditioning. But what about people living in Canada and Australia and people living? Then the body goes for a process called acclimatization. It is getting acclimatized. நீ ஏழையா வாழு இல்ல பணக்காரனா வாழு. நைட்ல ஏழை பகல்ல பணக்காரனா ரொம்ப டேஞ்சரஸ். So அங்க வாழ்றவங்க தெரியும். நீங்க you will have a question. What about Himalayasல வாழ்ற people, ஊட்டில இருக்கிறவங்களுக்குலாம் என்ன ஆகும்னா, that is why she told when the people is going for higher altitude, especially in hill stations, they get acclimatized. The erythropoietin is secreting more, the body is getting more tuned, and they don't generally change temperatures. So pyelonephritis. Okay, last process, two more points we will discuss. In elderly, sometimes the urine, when the urine is reduced, especially when you are in an air conditioner, you don't drink water, it is called oliguria. ஒழுகுறது அப்படி ஞாபகம் வச்சுக்கோங்க, ரொம்ப கம்மியா வருது. ஒலியூரியா is passing very less amount of urine. எப்படி ஞாபகம் வச்சுக்கிறதுனா கீவேர்ட்ஸ் நம்ம தான் உருவாக்கிக்கணும். நமக்கு தெரிஞ்ச வார்த்தைகளை வச்சு ஞாபகம் வச்சுக்கணும். ஒலியூரியா ரொம்ப கம்மியா யூரின் வரும். சில சமயம் நம்ம ஜுரம்லாம் இருக்கும், வாயெல்லாம் கசப்பாயிடும், தண்ணியே குடிக்க மாட்டோம், யூரின் வருதுன்னு போனாக்கா ஒரு 10 ஸ்பூன் யூரின் தான் வரும், ரொம்ப மஞ்சளா வரும். So passing dark urine. Okay. What is the color of urine generally? It is straw yellow colored. Straw yellow colored. Okay. When the urine becomes thick, more hyperosmolar, what can happen? It can end into formation of renal calculi. Renal calculi, stone. So stone oda vali eppadi irukum patient ku? The pain will come in the right flank or the left flank, radiating to the back. The patient will toss over the bed. So leave letter கொடுக்கும்போது renal stone போட்டு போறாங்கன்னா அவங்களால நிக்க முடியாது. So அப்ப அவங்க ஏதோ போய் சொல்றாங்க, நம்ம எடுத்துக்கலாம். The patient will toss on the bed. பொறுத்துக்கவே முடியாது, வலி இருக்கும். The pain is called loin to groin. Loin to groin. பின்பக்கத்துல இருந்து உயிர்நிலையை நோக்கி அந்த வலி வரும். associated with profuse sweating, perspiration, profuse sweating, perspiration and vomiting, profuse perspiration, and then pain from the loin to groin can come from right side or left side depending upon the stone. What is the process of stone? Hyperosmolar urine becoming more thick, deposition of calculi. So that is why the commonly placed calculi is at the vesico-ureteric junction. Ultrasound report பார்க்கும்போது enters like even in adults you will see some 3 mm calculi, 4 mm calculi. So generally calculi less than 4, it will come easily via urine because it matches with the diameter of the urethra and ureter. 4 to 7 will come with some difficulty. 7 to 10 with little more difficulty. More than 10, you might need a process called lithotripsy. வெளியில இருந்து அல்ட்ராசோனிக் பிளேட் வச்சு என்ன பண்ணுவாங்க, கட் பண்ண மாட்டாங்க, அதிர்வு கொடுப்பாங்க. இப்போ இந்த ரோட்ல எல்லாம் முன்னாடி எல்லாம் கடப்பாரை வச்சு குத்திக்கிட்டு இருந்தாங்க. இப்போ என்ன பண்றாங்க, நின்ன இடத்துலயே குத்துறாங்க. இந்த வைப்ரேட்டர், செல்போன் வைப்ரேட்டர் மாதிரி அடிக்கிறாங்க. அப்புறம் என்ன பண்ணுது, ஜேசிபி வச்சு நோண்டி எடுத்துறாங்க. நைட்டோட நைட்டா கேபிள போட்டு முடிச்சிடுறாங்க. ஸோ அந்த மாதிரி வெளியில இருந்து அல்ட்ராசோனிக் வேவ்ஸ் மூலமா அந்த ஸ்டோன்ஸை கரைக்க பார்ப்பாங்க. தட் இஸ் கால்ட் lithotripsy. Lithotripsy, and this is the process of renal calculi, and renal calculi can come even in young adults also. So depending upon there are various techniques of excretion, and they say you have to eat this food or that food. These are all not in vogue. You have to respect your thirst and hunger mechanism. தாகம் எடுத்தா தண்ணி குடிக்கணும். சில பேர் தாகம் எடுத்தாலும் தண்ணி குடிக்கவே மாட்டாங்க. கேட்டா எனக்கு தாகம் எடுக்கிறதே தெரியலன்னுவாங்க. தாகம் எடுக்கிறது எப்படி தெரியும்? வறண்ட வாய் மூலமாக தெரியும். So last we will encounter about carcinomas of kidneys. So commonly the carcinoma can come at the kidney level itself. It is called RCC, renal cell carcinoma. Renal cell carcinoma, one of the safe malignancy. So கடவுள் எனக்கு உனக்கு கேன்சர் தான் கொடுப்பேன், உனக்கு எந்த கேன்சர் வேணும்னு நான் கேட்டேன்னா, நான் முதல்ல கேட்கறது வேணா ரீனல் கார்சினோமா கேட்பேன். அடுத்து வேணா டெஸ்டிஸ், ஓவரி இல்லை, டெஸ்டிஸ், யூட்ரஸ், பிரஸ்ட் கேன்சரை கேட்கலாம். ஒருவேளை அப்படி ஒரு ஆப்ஷன் வந்தாலும் வரலாம், சொல்ல முடியாது. So இதெல்லாம் safe cancers where in the initial period the cancer can be eliminated and the patient can live a normal life. The removal of the treatment of RCC found earlier is called nephrectomy. Surgical removal of one kidney and the patient can live with a single kidney. So single kidney. So it is called renal cell carcinoma. Sometimes the carcinoma can come at the bladder level. This is little dangerous than the renal cell carcinoma because renal cell carcinoma you can remove here. This will function independently. This kidney will function. ஆனா இங்க கேன்சர் வந்தா இவங்க என்னதான் வேலை செஞ்சாலும் இங்க வந்து பிரச்சனை வந்துரும். The patient will start excreting hematuria, pyuria, and the patient will end into a difficult life. So renal carcinoma is different from bladder carcinoma, and sometimes in uncircumcised males, patient can have penile carcinoma. Uncircumcised. Who does circumcision by routine? Islamic people. It is proved scientifically that doing circumcision as soon as the child is born, within 1 or 2 days, is scientifically proven to prevent penile carcinoma. Circumcised males, especially not the circumcision, அதாவது திடீர்னு இந்த லவ்ல வந்து முஸ்லீம் பண்ண காதலிப்பாங்க, அப்போ மேரேஜ் பண்றதுக்காக சர்க்கம்சிஷன் பண்ணி பேரை வந்து மாத்திப்பாங்க சில பேர் இஸ்லாம். அந்த சர்க்கம்சிஷன் எல்லாம் காப்பாற்றப்படாது. பிறந்த உடனே முதல் நாள், இரண்டாவது நாள்ல சர்க்கம்சிஷன் பண்ணாக்கா அந்த குழந்தைக்கு வாழ்நாள் முழுக்க penile carcinoma வராது. Penile carcinoma will not come. So in circumcised males you can have penile carcinoma. So these are all the 3 carcinomas that is related in the excretory system. Renal cell carcinoma, carcinoma of the bladder, carcinoma of the penis. Already with the excretory system I have discussed already stress incontinence and urge incontinence, which will also be pertinent in this chapter, so I am not explaining about that. So last function, in patients with CKD, you will find patients being anemic. Generally dialysis போறவங்க erythropoietin injection போட்டுப்பாங்க weekly once. Anybody's relatives are getting dialyzed here? No. So at least your friends and relatives are getting dialysis, take a chance to see the case sheets. You will have patients getting weekly injections of erythropoietin. Because when the patient is having chronic kidney disease, all these functions will fail. All the functions will fail. The metabolism function, mineral metabolism, buffer action, anemic. So the patients, CKD patients will generally land up into anemia. They will have anemia, low hemoglobin. The CKD patients எப்படி தெரிவாங்கன்னா வெளுத்து தெரிவாங்க, blanched look இருக்கும், pale nails, pale tongue, pale conjunctiva. So everything will be pale. So generally they will have shortness of breath, easy fatigability, all the functions of, all the problems of anemia. Okay. Okay, with here we will stop. So with here we are completing excretory system. Though a small system, generally you have so many problems. So I have put lot of terminology in a single day. Try to remember them. இது வந்து நீங்க